Trigeminal neuralgia, once called tic douloureux, is a disorder of the fifth cranial nerve characterized by sudden, severe facial pain. The pain is paroxysmal, meaning it comes in sharp bursts, described by patients as shooting, stabbing, or burning. A key feature is that the pain is unilateral, affecting only one side of the face. During an attack, involuntary spasms of the facial muscles may occur, sometimes closing the eye or twitching the mouth, hence the old name, painful twitch. The cause is not always clear, but most evidence points to demyelination of the trigeminal nerve, either from pressure by a blood vessel at the nerve root or from an underlying condition such as multiple sclerosis. The condition is more common in older adults, especially between the 5th and 6th decades of life, and occurs more often in women. It is also seen more frequently in patients with MS. When trigeminal neuralgia occurs before the age of 50, MS should be considered. Pain-free intervals vary. Some patients may go minutes without pain, others may have hours or even days of relief. Over time, however, the attacks usually become more frequent and severe, and the fear of triggering an attack significantly affects quality of life. Everyday activities can bring on the pain. Washing the face, shaving, brushing the teeth, eating, or even feeling a draft of cold air may be enough to provoke an attack. Many patients identify trigger points, specific areas where even the lightest touch leads to pain. As a result, patients often avoid touching their faces, may neglect oral care, and adapt their habits in ways that serve as diagnostic clues. Medical management. Pharmacologic therapy is the first line of treatment. The most common medication is carbamazepine, an anticonvulsant that reduces transmission of nerve impulses. It is usually effective, but patients need close monitoring for toxicity, including serum drug levels and blood counts, since long-term therapy can suppress bone marrow. Side effects include dizziness, drowsiness, nausea, and in some cases, aplastic anemia. Other medications used include gabapentin and baclofen, which may be given alone or in combination. If pain persists, phenytoin can be added as an adjunct. When medication is not effective or tolerated, surgical options may be considered. The procedures aim either to decompress the nerve while preserving function or to intentionally damage the nerve to stop it from misfiring. Microvascular decompression involves moving the offending blood vessel away from the trigeminal nerve root and placing a small pad between them. This often provides significant relief, but requires an intracranial approach. Radiofrequency thermal coagulation creates a lesion in the nerve through a percutaneous approach. It can provide immediate pain relief, but may also cause sensory changes, such as loss of the corneal reflex or abnormal facial sensations. Gamma knife radiosurgery, a non-invasive procedure, uses focused radiation to target the nerve. Percutaneous balloon microcompression compresses the trigeminal nerve root briefly, disrupting pain transmission. Nursing management. Nursing care for trigeminal neuralgia focuses on both preventing pain and supporting recovery after surgery. Preventing pain. Patients should avoid triggers. The nurse can suggest strategies such as using cotton pads and room temperature water to wash the face, rinsing with mouthwash instead of brushing if brushing is painful, and eating soft foods at room temperature. Chewing should be done on the unaffected side. Since anxiety and depression are common in patients with chronic pain, the nurse should also assess emotional health and connect patients with resources for support. Postoperative care. After surgical interventions, nurses perform neurologic assessments to check motor and sensory function in the branches of the trigeminal nerve. If sensation is lost, patients must be taught not to rub the eye on the affected side, since injury could go unnoticed. Artificial tears may be prescribed to prevent dryness. Patients are advised not to chew on the affected side until numbness has resolved, and swallowing should be monitored to ensure safety when eating.